Tantor Audio, a division of Recorded Books, presents the Traumatic Stress Recovery Workbook. 40 brain-changing techniques you can use right now to treat symptoms of PTSD and start feeling better. By Jennifer Sweeton, Doctor of Psychology. Narrated by Tara Marie Kirk. Publisher's Note: this publication is designed to provide accurate and authoritative information in regard to the subject matter covered. It is sold with the understanding that the publisher is not engaged in rendering psychological, financial, legal, or other professional services. If expert assistance or counseling is needed, the services of a competent professional should be sought. Introduction. If you've experienced psychological trauma, you're probably aware of how it can impact your relationships, professional life, and overall functioning. In fact, many survivors report that there is no domain of their life that it hasn't touched in some way. However, if this has happened to you, you're not alone, and recovery is possible. As a trauma psychologist, I've treated hundreds of people who have been traumatized by war, abuse, neglect, natural disasters, accidents, sexual assault, and various other forms of violence. Despite all of the pain and heartbreak I've heard about, I remain hopeful and optimistic about everyone's potential to heal, as I've seen amazing growth and recovery even after the most debilitating trauma. While everyone's story is different, and no two people's healing journeys are alike, I've found that people's reactions to trauma can actually be quite similar, and many clients report the same challenges after trauma. For instance, a couple of common reactions to trauma are sleep difficulties and anger problems. And the good news is that there are techniques that can help you address these issues. This book describes 9 of the most common challenges facing trauma survivors and offers 40 tools and techniques you can begin using right away. It is my sincere hope that you will find this workbook helpful in your recovery journey. Self-assessment. Is this book for you? As a unique person with your own reactions, there is no research study or book that can fully capture and address the entirety of your experience. However, this book may be for you if some of the following challenges seem familiar to you. For example, if you found it difficult to trust other people or manage anger after your trauma or traumas, you're not alone, and this book may be beneficial as you learn how to tackle these challenges. Listen to the following self-assessment and ask yourself whether these topics or themes resonate with you. You can also visit newharbinger.com/48848 to download a copy of this exercise. Common challenges after trauma. Common challenge. Have I experienced this? Yes or no? If so, how problematic or distressing is it? 1 through 10. 1 equals not at all. 10 equals extremely. Intrusive thoughts about the trauma. Feeling anxious and revved up. Difficulties with anger. Strong, distressing physical reactions. Emotional numbing and apathy. Issues around safety and control. Difficulties with trust and relationships. Isolation and agoraphobia, fear of leaving home. Sleeping difficulties. Reviewing your answers, what do you notice? Did you answer yes to any of the topics in the common challenge column? If you did, and you scored a 5 or above on 1 or more of the challenges, then this book was written for you. Like many other trauma survivors, you're likely experiencing post-trauma difficulties that are impacting your life. The tools and exercises in this book help survivors begin to address these exact challenges. How to use this book. While it may work fine for you to start at the beginning of this book and listen through to the end, that may not be what you're most needing. Instead, begin by listening to this introduction in its entirety in order to understand the neuroscience and types of techniques referred to throughout the book. The next 2 sections of this introduction cover these 2 topics. Next, listen to the chapters that focus on the topics you find to be most problematic or challenging for you. Then, as is relevant to you or desired, listen to the remaining chapters. Each chapter is designed to stand alone, though some chapters reference techniques described in other chapters, which you can easily locate. Note, there are many exercises and worksheets in this book that you can also download at this book's website, newharbinger.com/48848. The Neuroscience of Trauma. Although this book frequently references the neuroscience of trauma, don't worry, you don't need to become a neuroscientist to understand it. The brain is immensely complex, but some of the main brain areas involved in psychological trauma can be summed up in a straightforward manner. Here's a quick introduction to the 4 main areas of the brain impacted by trauma. 1. The amygdala, known as the smoke detector of the brain. This tiny, almond-shaped brain structure lies deep inside your brain. Though it be tiny, it is very powerful, as it is the area of the brain that alerts your entire brain and body when danger or a threat may be present. It is called the smoke detector because its main job is to detect signs of danger, even small ones. When the amygdala senses that something is wrong and potentially harmful, it activates, sending alarm signals to your whole body, instructing it to prepare to fight, flee, or freeze as a way of coping with the threat. When this occurs, you'll definitely feel it. Amygdala activation feels like stress, upset, anxiety, sadness, and even rage. You may know the amygdala has been activated when you feel frantic, a racing heart, shallow breathing, muscle tension, or other physical symptoms of stress. After trauma, it is common for the amygdala to activate more easily, even in response to non-threatening situations. It can also occur that the amygdala switches on after trauma, so the person feels on edge, vigilant, and stressed all the time, regardless of the circumstances. A main goal of trauma treatment is to lower activation of this brain area, which will allow you to think more clearly and feel calmer. 2. The insula, known as the body sensor of the brain. This brain structure is extremely important as it helps you experience and understand your emotions. Specifically, the insula alerts you to sensations occurring in your body, such as rapid heart rate or muscle tension, and then helps you interpret or understand what those sensations mean with regard to emotion. For example, a racing heart could be interpreted by the insula as fear or anxiety. I am scared of roller coasters. Or it could signal excitement. Roller coasters are thrilling. How you experience your body and which emotions are derived from your sensations is largely dependent on your insula. After trauma, the insula's activation can lower, making it difficult to connect with your body and your emotions. This can lead to numbing or apathy. Thus, after trauma, it is important to strengthen this area of the brain. 3. The hippocampus, known as the memory storage unit of the brain. A lot of brain regions are involved in memory, but the hippocampus is arguably the most well-known. In particular, the hippocampus, which is located close to the amygdala, helps you encode and store long-term memories. Whenever you remember something that happened in the past, you're pulling that information from the hippocampus. After trauma, the hippocampus can become less activated and can actually shrink due to cortisol, the stress hormone, damaging it. In other words, the stress of trauma can damage this area of the brain. Thankfully, however, the hippocampus can be strengthened and reactivated, which is a goal of many trauma-focused therapies. 4. The prefrontal cortex, known as the thinking center of the brain. This large brain region is near the top of your brain, located behind your forehead. It's known as the thinking or executive functioning center of the brain because of its involvement in planning, goal setting, logical thinking, reasoning, and concentration. When your prefrontal cortex is working well and is adequately activated, you can reason through and evaluate situations well. You are clear-headed. After traumatic events, however, this region can become less activated, making it difficult to focus, make decisions, regulate emotions, or make sense of the world. Thus, it is important for trauma survivors to practice skills and techniques that strengthen the prefrontal cortex. Bottom-up versus top-down techniques. The skills in this workbook will help you facilitate your own brain change after trauma, altering the amygdala, insula, hippocampus, and prefrontal cortex in the direction of health. In each chapter, you'll hear a bit about which post-trauma challenges your brain needs to address, and several techniques will be presented for you to try. These techniques, or skills, tend to fall into 3 categories: behavioral techniques, bottom-up techniques, and top-down techniques. Behavioral techniques. These techniques emphasize the importance of behavior. While other techniques may ask you to think about something or notice something about your experience, behavioral techniques focus on what you do or how you behave. Sometimes, the best way to think or feel differently is to actually act differently. For example, a basic concept in exposure therapy is that if you want to conquer something that you fear, you have to face it or do it. Some exercises in this workbook encourage you to engage in certain healthy behaviors, which can help rewire and shift the brain areas described earlier, making you feel more confident and less stressed. Bottom-up techniques. These techniques work with the body, including physical sensations and the breath, to change the brain after trauma. Some bottom-up techniques include paying attention to the body, engaging in deep breathing exercises, or moving the body in particular ways, as you would in yoga. Because the brain is connected to the body, a great way to change the brain is to work with the body. And that's exactly what bottom-up techniques help you do. You'll notice that some bottom-up techniques are recommended in every chapter of this book, and for good reason. Because bottom-up techniques are often especially effective at helping you learn how to decrease amygdala activation, the brain smoke detector, and increase insula activation, the brain's body sensor. Some of these techniques can also strengthen the hippocampus, the brain's memory storage unit, and prefrontal cortex, the brain's thinking center. Top-down techniques. These techniques can also facilitate healthy brain change, but in a different way than bottom-up techniques. While bottom-up techniques work with the body from the bottom up to change the brain, top-down techniques work with your mind or thoughts to change the brain top-down. Top-down exercises include analyzing scenarios, seeing whether there are other ways of interpreting situations, thinking differently about your life, and some types of meditations. These skills can be especially helpful when you want to increase the prefrontal cortex's activation or strengthen the hippocampus, although some techniques can positively impact the insula and amygdala. Although a lot of techniques can be considered hybrid skills, containing both behavioral and bottom-up elements, or bottom-up and top-down elements, there is usually one category that best describes any given technique. In this workbook, you'll notice that techniques are noted as being in one or more of these categories. Chapter 1. Intrusive Thoughts About the Trauma. Deshaun, a 30-year-old man, stopped at a gas station for a soda one night 2 years ago. While he was inside, an armed robber burst into the gas station and held everyone inside hostage. While Deshaun was not physically hurt during this event, he witnessed the shooting of a gas station attendant and 2 customers. Since that time, no matter how hard he has tried to put the event out of his mind, he finds himself replaying some of the details of that night over and over, almost every day, and even has nightmares about it at night. Check-in. Your experiences. After hearing about Deshaun, take a moment to think about your own experiences. You may choose to reflect and journal on the following questions. Have you ever felt similar to Deshaun, where you have replayed something terrible that happened over and over? Have you tried not to think about something traumatic that occurred? When you push it out of your mind, what happens? What, if anything, tends to help you when you try to avoid thoughts and feelings about the event? How have intrusive thoughts impacted your life? What was life like before you had to manage these thoughts? How intrusive thoughts may impact your life. Relentless, intrusive thoughts can be frustrating, scary, and exhausting to manage, and are unfortunately very common after traumatic events. If you struggle with intrusive thoughts, you may notice that the thoughts negatively impact multiple domains of your life, including family, friendships, work, school, and productivity more broadly. In particular, it is not unusual for trauma survivors to appear distracted and disengaged from family and friends as a result of their mind getting stuck on traumatic memories from the past. When this happens to you, it can feel like a broken record or a loop where you replay a piece of your history over and over. Additionally, when unwanted thoughts take over, this can impact performance at school or work, because these thoughts make it extremely difficult to focus on the task at hand. You may find that you have to read the same material over and over to digest it, sometimes forget tasks, and easily lose your train of thought as your mind seems constantly drawn to thoughts about the trauma or traumas. Over time, this can lead to exhaustion and increased anxiety and depression, in addition to more severe post-traumatic stress disorder, PTSD, symptoms. The following brief self-assessment is a fast way to determine whether you might be experiencing problematic, unwanted, and intrusive trauma-based thoughts. You can also visit newharbinger.com/48848 to download a copy of this exercise. Problematic intrusive thoughts self-assessment. Listen to the following and identify the best response on a scale of 0 to 3, where 0 equals none or not at all, 1 equals a little bit or sometimes, 2 equals a moderate amount or often, and 3 equals a lot or most of the time. Since a trauma or multiple traumas happened, I find that I think about it a lot. It is hard for me to stop thinking about my trauma or traumas when I start thinking about it. I think about my trauma or traumas by accident, without meaning to. I catch myself thinking about my trauma or traumas without knowing I was thinking about it. Images of the traumatic event or events come to mind when I don't want them to. Sounds of the traumatic event or events come to mind when I don't want them to. Sensations related to the traumatic event or events come to mind when I don't want them to. Thoughts of the trauma or traumas distract me from things I need to be doing or focusing on. Thoughts about the trauma or traumas have negatively impacted my school or work productivity. I take longer to complete tasks because I'm distracted by thoughts of the trauma or traumas. It is distressing to me when I think about the trauma or traumas. My body reacts with distress, racing heart rate, stomach pain, chest tightening, etc., when I think about the trauma or traumas. I feel sad, angry, scared, or other distressing emotions when I think about the trauma or traumas. The strategies I've tried to stop thinking about the trauma or traumas do not work well. I have tried drinking alcohol or doing drugs to stop thinking about the trauma or traumas. Other people have told me I seem distracted or distant from them when I've been thinking about the trauma or traumas. When I think about the trauma or traumas, it puts me in a bad mood. My thoughts about the trauma or traumas negatively impact my relationships with other people. My thoughts about the trauma or traumas feel like a movie reel playing over and over, where it is difficult to stop the reel from playing. Even small triggers make me start to think about the trauma or traumas. Thoughts of the trauma or traumas keep me up at night, making it hard to fall or stay asleep. Add up the total score from these items and record your total. A score of 24 or higher indicates that you likely experience problematic intrusive thoughts related to past trauma. While for some people, these thoughts fade within a few months of the trauma occurring, for others, they may persist for many years or indefinitely. If your intrusive thoughts are persistent, exhausting, and impacting your work or social life, seek help to better manage and reduce them. The information and exercises in this chapter can help you as you begin to address intrusive thoughts. But for many people, professional help from a licensed psychotherapist is also immensely helpful. Use the following exercise to reflect on your self-assessment score. You can also visit newharbinger.com/48848 to download a copy of this exercise. Reflect on your self-assessment score. What did you score on the self-assessment? Was this surprising to you? Take a moment to reflect on and process what you just learned about yourself. You may consider the following questions as you reflect on your experience with this. Was your score higher than you thought it would be? Lower? What does your score indicate about you and the challenges you're experiencing? Were there items on the assessment you hadn't considered before? Were there items on the self-assessment that surprised you? Are your intrusive thoughts something you think you should address? Why intrusive thoughts after trauma are so common. Intrusive, trauma-related thoughts are one of the more common and distressing symptoms of PTSD. While you may want nothing more than to forget about a traumatic event after it happens, your brain will likely ensure that the memory of it is never far. Though frustrating, disruptive, and often scary, intrusive thoughts persist in large part because of how traumatic memories are stored in the brain. Specifically, during moments of extreme stress or trauma, the brain encodes memories in a way that ensures they will be replayed or thought of often. At the time of a traumatic event, your body and brain become flooded with cortisol, the stress hormone, as your stress response increases. When this happens, the hippocampus, the long-term memory storage unit that helps you encode memories, becomes saturated with cortisol. This is due to the large number of cortisol receptors covering the hippocampus. When cortisol rushes to the hippocampus, it can impact how the hippocampus activates and, ultimately, how trauma memories become encoded in the brain. Because cortisol can compromise the functioning of the hippocampus, traumatic memories are often encoded and consolidated differently from non-traumatic memories. For example, when cortisol prevents the hippocampus from fully activating, a trauma may be encoded in a fragmented manner, where the sensory details and facts about a memory are stored in a disjointed way. When this happens, you may remember parts of the memory in flashes, smells, or sounds, but these experiences may feel disconnected from one another, almost like pieces of a puzzle that you struggle to put together. Fragmented memories such as these are especially difficult to cope with, because these fragments lack context or coherence that would allow you to rationally analyze them and soothe yourself. For example, if one memory fragment is of a knife and it does not contain context, a knife is dangerous when an intruder is pointing one at me, but not when I'm eating dinner with my family. It becomes universally threatening, and there is a generalization of fear with regard to these fragments. The presence of a knife means my life is at risk. Also, when a memory is shattered into 1,000 pieces, like a broken mirror that you cannot reconcile or integrate, it can feel as though you're constantly stepping on shards of glass with no warning. Even small, innocuous stimuli may trigger one or more of the shards, which is less likely to happen when memories are more integrated and contain context. Thus, one thing that makes trauma memories so hard to manage is that their fragments frequently pop up, often unexpectedly. This can feel very exhausting and can lead to avoiding people, places, or situations where you fear you might become triggered. The way trauma memories are encoded can also lead to a generalization of fear of many different stimuli, situations, people, and places, and it can make it scary to live a full life, as you may always be questioning what might trigger one of the memory shards. To better understand why intrusive trauma memories are so common, here is a summary of what happens in the brain when you experience trauma. 1. When trauma happens, the amygdala activates. When you experience trauma, your amygdala, the fear center of your brain that detects threat, becomes activated. This sets off a chain reaction where the rest of the brain is warned about the threat, and the threat signals are communicated down to the body. This is likely what happened when Deshawn first realized something terrible was happening in the gas station. 2. Your body activates the stress response. When the amygdala detects danger, it communicates with the hypothalamus in order to activate the stress pathway, called the hypothalamus pituitary adrenal HPA axis. When the HPA axis activates, the entire body enters the stress response, which prompts more than 1,400 biochemical and psychophysiological reactions, including the release of cortisol, which is often referred to as the stress hormone. 3. Cortisol floods the hippocampus. Because the hippocampus, the memory center of the brain, is covered in cortisol receptors, cortisol rushes to the hippocampus and saturates it when you become very stressed or traumatized. At the same time this happens, the hippocampus begins the process of encoding the memory of what's happening during the trauma to ensure you don't forget it. However, with cortisol flooding this brain region, it makes it difficult for the hippocampus to function.
Sample complete. Ready to continue?